ma'am. Welcome to all. Myself Ramya, lecturer of and College of Pharmacy. Today I am going to discuss about antihypertensive drugs. First is about the introduction of hypertension. Hypertension is a very common disorder, particularly in past middle age. It is not a disease in itself, but it is an important risk factor for cardiovascular mortality and morbidity. Then antihypertensive drugs are these drugs used to lower the BP in hypertension. Then classification of antihypertensive drugs. First diuretics, thiazide diuretics, hydrochlorothiazide, chlorthalidone, then high ceiling furosemide, potassium sparing spironolactam amiloride, AC inhibitors, captopril, enalapril, lisinopril, ramipril, fosinofil, angiotensin blocker, losartan, carnesartan, valsartan, telmisartan, direct renin inhibitors, then calcium channel blocker, verapamil, diltiazem, nifedipine, amiloride, etc. Then beta adrenergic blocker, propranolol, metoprolol, atenolol, etc. Beta plus alpha adrenergic blocker, labetalol, cardividiol, alpha adrenergic blocker, parasosin, terasosin, doxazosin, pendolamine, then central sympatholytic, clonidine, methyl-dopa, then vasodilator, atriolar, hydralazine, minoxidil, then atriolar plus venous sodium nitroprusside. These are the drugs used to treat antihypertension. Then mechanism of action. First, diuretics, thiazide diuretic. These are the drugs used to block the sodium chlorine symportal in distal tubules. It leads to fall the cardiac output, result fall in BP. Then high ceiling diuretics, high ceiling diuretic action on the sodium, potassium and chlorine inhibit the ASC-LH. It reduction of plasma volume and decrease the cardiac output. It leads to decrease BP. Then potassium sparing diuretics. Potassium sparing diuretics lower the BP slightly, but they used in conjugation with the thiazide. It lead to the antihypertensive action. Then ACE inhibitors. These are the drug are the first choice for hypertension. AC inhibitors or inhibit the conversion of A1 to A2 for the therapy of hypertension. A2 induce vasoconstriction and rise BP, and A2 increase the force of myocardial contraction by promoting calcium influx. It leads to ACE inhibitors or block the conversion of A1 to A2, then it leads to lower the BP. Then angiotensin blocker. These are the drugs used to block the angiotensin 1 and angiotensin 2 receptor, resulting the relaxation of smooth muscle and promote vasodilation. It increases the renal salt and water excretion, also reduce the plasma volume and decrease cellular hypertrophy. Then calcium channel blocker. These are the drugs having positive inotropic effect, bromotropic actions. All calcium channel blocker lower the BP by inhibiting the calcium influx of calcium channel. It leads to the smooth muscle relaxation and decrease the vascular peripheral resistance. It results in fall in the BP. Then beta adrenergic blocker. Beta adrenergic blockers are basically in heart rate, decrease force of contraction. It decreases the cardiac output and result decrease the peripheral resistance on each blood vessel. It decreases the BP. Then alpha plus beta adrenergic blocker. It is a combined alpha 7 beta blocker reduce TPR. It reduce the pressure and useful in the treatment of hypertension. Then alpha adrenergic blocker. These are the drug is a prototype alpha 1 antagonist dilate both resistant and capacitant vesicles. Reduction in TPR and BP, which only slightly decrease in venous return and cardiac output, are similar to that produced by direct acting vasodilators. Then central sympatholytic methyldopa. The drug has an alpha-methylene analogous of dopa, the precursor of dopamine, DA and NA. The alpha-methylene NA forms in the brain and act alpha-2 receptor to decrease the effervescent sympathetic activity. It also decreases the total peripheral resistance and more than the HR or CO. Then it leads to the falling BP. Then vasodilator, nitrate drugs are rapidly denitrated enzymatically in the smooth muscles to release the reactive free radical of nitrous oxide with the activate cytosol guanyl. It increases cyclic GMP, cause depolarization of myosin light chain kinase through a cyclic GMP dependent protein kinase. It reduces the availability of phosphorylated MLCK inference with activation of myosin. It failed to interact with the acetine to cause contraction. Consequently, relaxation occurs. Raised intracellular cyclic GMP may also reduce calcium entry. Its contributions of relaxation of smooth muscle, it reduces the BP. Then pharmacokinetics of captopril absorption 70% orally administration distribution BBB poor penetration. Then metabolism, it is metabolized by liver, excretion unchanged in urine. Uses of antihypertensive drugs are hypertension, CHF, myocardial infarction, diabetics, nephropathy. Then adverse effect of hypertension are hypotension, cough, rashes, angioedema. Thank you.